Hello, I'm Dr. Ian Strawford. I'm a cosmetic and wellness doctor, and I'm the medical director of Skin Excellence Clinics. Do you suffer with dark circles and under eye hollows that make you look sort of tired and run down all the time? Well, if you do, then you have something we call tear trough hollows or tear trough deformities.
What causes tear trough hollows?
So the tear trough is an anatomical feature on our face, and it represents where the orbit, which is the bony socket that our eye sits in, it connects to the eyelid muscle called orbicularis. And it's in the corner of our eye, it's very tight. And we'll see this as a little groove or a little hollow, normally, even in very young children. But as we age, then the bone can become lower down on the orbit here, and there is a volume loss in the cheek beneath that pulls this ligament down, and it creates a sort of hollow underneath the eye that can extend all the way around the eye. And it's literally called the tear trough because, as you can imagine, if we cry, the tear runs out of the eye in the corner and down our cheek. But the appearance of a hollow is that light falls into it, so it appears darker. So it looks like a dark shadow underneath our eye. And that's why we call it a dark circle. And it's due to the tear trough hollow.
At what age can tear trough hollows become an issue?
So actually, with facial aging, the bony changes and the volume loss in the deep fat pad underneath here in the cheek can become evident even in your mid-20s and sometimes even earlier. So it's not uncommon to see patients in the clinic in their 20s and early 30s complaining of the dark circles and the under eye hollows due to the tear trough. But in most people, we're seeing these changes, and it can be men and women, really dependent on how they're aging, and their facial shape and structure will predict as to what age they'll start to see this problem.
How are tear trough hollows best treated?
So tear trough hollows are a complex area to treat because obviously, as you can imagine, the under eye area is a very delicate and sensitive area to treat. And to treat that area, we often use a filler or a dermal filler. But that filler cannot go just beneath the skin because it will be seen and it will cause lumps and bumps. So I see a lot of complications where fillers are placed inappropriately in the tear trough. To get a natural and improved look in the tear trough, it has to be placed on the bone just along the eye socket margin to lift everything up. So it lifts that hollow so there is less depth there, less light falls in it, and it appears less dark. And that sounds very simple, but we have to be very careful in placing the right filler in the tear trough. You don't need large amounts, but it is a highly technical and skilled procedure.
I've heard it can be dangerous to treat the tear trough hollows with filler, even causing blindness.
That's correct. The tear trough hollow treatment is technically a very difficult treatment to place that filler safely and effectively where it needs to be to get a good natural result. I've honed my technique over many, many years, and I've actually taught many other doctors and surgeons with the tear trough filler technique. And I use particularly a blunt tip cannula going beneath the skin very deep down. And in my view, that is the only safe way to place a tear trough filler because there are some very important anatomical structures in that area that can be easily damaged, particularly the blood vessels in the deep tear troughs, which do connect eventually to the back of the eye. So it is a high-risk area, especially for somebody who's not skilled in the procedure. And it's a no-no in my book to even go anywhere near that area with a needle. It has to be a blunt tip cannula. So it's really important that you seek a medical professional, not a lay person, but a medical professional who is skilled in tear trough fillers for it to be done effectively and safely.
What patients are not suitable for tear trough fillers?
Not all patients are suitable for tear trough fillers. I find with advancing age, then there are other complicating factors. There may well be the tear trough hollow due to the volume loss and the bony changes, but there may also be a lot of eyelid aging, specifically laxity of the eyelids with eye bags underneath the eye and fluid collections. And those patients may find that actually the fluid collection underneath the eye and in the eyelid can be exacerbated by tear trough fillers, especially if they're not done correctly. So with these patients, maybe a combination of treatment is needed. Maybe we need to address the eyelid laxity as well as the tear trough hollows. And so we may be looking at even surgery for the eyelids or a non-surgical eyelid tightening in combination with the fillers. But certainly careful assessment of the patient pre to treatment with an experienced practitioner is key here.
What are the alternatives to tear trough fillers?
So there are some alternatives we can look at if we're not prepared or a patient is not prepared to have a filler treatment in the tear trough. I find that some of the most effective treatments are trying to naturally rejuvenate some volume in that deep tear trough. And for many years, we've used PRP, often called the vampire treatment, where we're taking your own blood, getting the growth factors from the platelet cells and injecting them deep and beneath the skin, trying to rejuvenate that area. And that can sometimes work quite nicely. It does require repeated treatments to get a good result, and it may not last as long as say, a filler. Increasingly, we're using polynucleotides, which are these RNA fragments from the DNA of fish sperm. One I particularly have had a lot of success with is called Planest I, which is a simple treatment. Again, I place the polynucleotides with a cannula very, very safely with minimal trauma to the under eye area. And we can actually treat the eyelid at the same time with polynucleotides. So that can give a nice natural rejuvenative effect. But unfortunately, if you have very deep tear trough hollows, it's really not going to work as well as a filler on its own.